So, the big pillar we keep hammering home throughout the conversation is metabolic health. That's something we can control and prevent a lot of this heart disease. You mentioned genetics. What other factors outside of those are working independently of this metabolic health piece, causing damage to arteries? Things like sedentary lifestyle, smoking, other factors people need to consider to get the full picture.
Well, I'm going to start with a very my brain tends to go backwards and it tends to confuse people. So please let me give you some forewarning. I'm going to start with one of the more unusual things, and then we'll get to what you're talking about. I thought you were going here. There are causes of inflammation that are not cardiovascular, but can cross over to cardiovascular inflammation. And let me give you a couple of examples. Rheumatoid arthritis and a thing called psoriatic arthritis. You've heard of psoriasis?
Yep.
These are autoimmune problems. And both of those, once you get psoriasis to a point where it's psoriatic arthritis, both of those things cross over. And both of those things create as much increased risk for heart attack and stroke as diabetes. We just don't hear about those that often because they're just not that common, not nearly as common as metabolic disease, where 90% of us have some of that. So we tend to think of lifestyle-related issues. When I see a patient with psoriatic arthritis or rheumatoid arthritis, especially psoriatic arthritis, I'm following their C-reactive protein, which you may have heard of. I'm following their C-reactive protein, and so is their rheumatologist in terms of major determinants of their health. So that's something else that can cause major problems with arterial health, but just not as many people have them. To go back to your point, yeah, a lot of people smoke. A lot of people vape. A lot of people have sedentary lifestyles. And those things can be radioactive for arterial health. For my crowd, the folks that tend to come see me, I rarely get a smoker. I get people that have watched my channel on YouTube, and so they tend to be folks that have totally turned their lifestyle around already, or folks that already had a good lifestyle and they're focused on it. But I still have a large group of people that are in their 60s and older. And here's one of the things that you tend to see with older groups. They don't focus as much on muscle. And you're talking about exercise and muscle. Again, it gets to that thing about lifestyle is not just mom and apple pie. It is critical to your longevity. As we get beyond our mid-60s, a lot of people would say, and I think they've got a good case, that loss of muscle, metabolically active muscle, is maybe becoming even more important on a population basis than having too much fat. Because metabolically active muscle is our best internal safety valve against blood sugar going up. You see these cute little old men or cute little old ladies that have thin legs. That is a big, big problem. It's not cute little. These folks have a big problem and a lot of risk. I've noticed, because of our channel, we continue to watch and see who's publishing what. I noticed recently something that was really exciting to me. Somebody did a video on 3 leg exercises that you must focus on if you're old, if you're elderly. And it's like, that thing took off. I never, ever would have thought people would have gotten interested in it. But they've demonstrated things like soleus push-ups. Have you heard about those?
No.
So the soleus is the muscle in the calf, one of the 2 big muscles, the soleus and gastrocnemius. And you're let's say, okay, we went to a meeting, everybody was seated, they had a lunch, I ate some stuff I'm a little bit nervous about. Maybe he's had some bread or something. And I'm sitting here. I have to remain seated. Maybe I could go, you can't go up and stand. I'll usually go and stand in the back of the room. But what they did was they said, look, we think people can help their blood sugar even with what we call a soleus push-up. And that is just simply having your foot on the ground and pushing it up like that, or even bouncing a little bit. And so you've got that one muscle, but it's a large muscle. It's a leg muscle. And it's bouncing and it's active. It pulls that glucose in without having to worry about failing insulin receptors. And they did. They've demonstrated that. And a lot of folks in my community talk about you can even just do soleus push-ups while seated and still improve your blood sugar. You don't have to get on a salt bike. You don't have to go walking down the block. Just some soleus push-ups.
Before we move away from the muscle, I want to make sure we acknowledge the two different pieces of this. And the latter part of what you're discussing there is using muscles to bring the glucose down, which in turn is going to help keep insulin down. Before, you're talking about muscle being a safety release valve.
Yeah.
And I assume in that case, you were talking about building muscle and being preventative that way. So let's talk about the physiology of that piece, where taking time, going to the gym, putting on muscle, especially in the legs, is going to help with your metabolic health down the line.
Well, actually, let me, if I could, take it in a similar direction, but talk about a couple of things that I think are very helpful to think about. And it's two different components of muscles. First of all, if we realize that these muscles that support us, the thighs, hips, calves, they are our largest muscle mass. Back in the pumping iron days, the bodybuilders used to talk about new bodybuilders. And they'd say, yeah, he came in, he just worked his arms like crazy and he's getting nowhere. And the other advanced bodybuilders knew why. He wasn't working his legs. If you don't work your legs, you don't really change your metabolism. And we always talk about that with our patients and we say, look, we're not trying to make you a bodybuilder. What we're trying to do is change your metabolism. Now, there's two major components to these large muscles of the legs that are important. One is the capillaries that we talked about a few minutes ago, the major area of real estate, the major area of real estate for the insulin receptors, and the major area of interface between the blood supply and the muscle. But there's another key component. Anybody that's read anything about longevity for the past 50 years has probably heard about it, and it's called the mitochondria. So the mitochondria is very much related to strength. And that's where we start talking about getting some, what you're talking about, going in preventively, making sure that you have good strength, hitting your 60s, your mid 60s, and making sure that you don't start to lose that muscle, because mitochondria have been a part of the anti-aging formula, or destroying mitochondria, losing mitochondria have been a big part of every aging, or not every aging, but the vast majority of aging mechanisms discussed for the past 60 years. So first of all, you want to have strength. And then I'd get back to those capillaries and say, you also want to have good capillary penetration of those muscles. And that's where you come in with the oxygen deprivation or the HIT, the re-HIT. So not only strength, but the capillaries as well.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
I started as an ER doc. I love doing emergency work, but most of these things coming into the ER should have never happened. High levels of glucose or even high levels of insulin irritate that